The Greater Boston chapter of United Spinal Association is a 501c3 nonprofit organization that provides support services to individuals after spinal cord injury. These support services include peer mentoring, discussion groups, educational programming, and various social events throughout the year. These services are available to anyone at any time after spinal cord injury. Our organization identified the need for a video such as this one to provide personal experiences from some of our chapter members to help you avoid getting worse once you leave rehab. We present to you 3 members that explain their spinal cord injury, their challenges and symptoms on 3 specific issues, and what they would do differently if they could have a do-over. The 3 very common issues that we identified that you should pay serious attention to are pressure wounds, urinary tract infections, and mental health.
My name is Emmett Lyman. I'm a C5-6-7 quadriplegic. I had an accident about 2 years ago when a rock fell on my head while I was rock climbing and left me in this state. Prior to my injury, I was really active and I felt stronger than others around me. I assumed that when I became injured, I would still be stronger than others around me and probably less susceptible to the types of injuries that they dealt with. Unfortunately, I learned the hard way that once we have SCI, we're all very exposed to something called pressure sores. I had my pressure sore form within weeks of leaving my inpatient stay in rehab. I had an underinflated cushion on my chair and it left me with a large sore. Once the pressure sore began, I couldn't seem to get it to heal. Several months after I was discharged and my pressure sore started, I ended up having to receive something called a flap surgery, where they essentially had to sew my skin back together. Unfortunately, that necessitated spending several months in bed on my side afterward. It was much worse than what I would have gone through had I just addressed it correctly at the beginning. And today, I'm now more at risk than ever for a new pressure sore in that same spot. So be vigilant and take extra care to address any pressure problems immediately. Since my injury, I've had several incidents with minor urinary tract infections, or UTIs, which I was able to address quickly with the help of my urologist using antibiotics. Still, these aren't something I was familiar with prior to my accident because I'm a male, and males don't typically get these unless we have something like spinal cord injury. But now, we need to catheterize regularly, either intermittently or through an indwelling solution, and this causes bacteria to enter into our bladder, causing immeasurable pain and suffering for our bodies over time. My most serious UTI to date was miserable. It felt like a nasty flu for over a week. Fortunately, I avoided a nasty side effect called autotonic dysreflexia, or AD. Nevertheless, I've experienced AD several times since my injury from a related problem called clogging in my indwelling catheter, and those have been the scariest moments of my recovery. AD is very serious for folks with SCI, as it can lead to stroke and ultimately death. And more problematic, it's very, very common for all of us. AD comes on very suddenly for me. Starting as a light headache, it gets progressively worse, and then after a half hour or so, it's so bad I can barely function anymore. And AD is incredibly dangerous, but it's also surprisingly common for those of us with SCI. Take UTIs and overall bladder management very seriously, and avoid AD at all costs. During the first several months after my injury, I didn't experience depression. I think I was just too focused on my recovery and probably too happy just to be alive at that point. But after a while, it started to become true for me. I started to realize that my old life was over and I had to come to grips with the new one. As it happens, the first year or 2 after injury are the ones that are most challenging to your health and the ones where it's most unstable. Various problems that I dealt with, like pressure sores, bladder problems, and some crushing losses in my personal life, all exacerbated the onset of depression. Thankfully, I've been able to keep it under control and maintain focus on my recovery despite all the problems. An important part of dealing with this depression has been talking to folks that can help me. Therapists are available throughout the medical community and are often subsidized by insurance. Moreover, the Boston chapter of United Spinal Association offers peer mentors who have gone through this before, and they're more than willing to talk to you about depression and how to work through it best. These mentors are an invaluable resource, so please take advantage of them.
Hello everyone, my name is Midge DeWicki. I live in Saugus, Massachusetts. I was injured about 16 years ago in a freak accident. I was leaning on the railing on a deck, and the railing gave way, I hit my chin when I fell, which left me a C5, C6, complete quadriplegic. Since then, I've learned to live with this disability. I want to talk to you today about pressure wounds, because when you're in a wheelchair like me, a lot of times you're just prone to these pressure wounds. And once you get them, they're very hard to make them disappear. You have to go to the wound clinic and they give you some medication to put on it and bandages and everything. So it does take a long time to get rid of them. And this type of wound, you have to be real careful, because if it gets infected and goes into the bone, that's a whole different ballgame. So I have one, I've had it for 1.5 years. It was real big when it started. Now it's down to the size of a pencil eraser, which is great because I know it's on the way to going away. Actually, Christopher Reeve had one, and I think he passed away from that. The other thing I'll talk to you about are UTIs. I've really never had a UTI, but the reason being, I chose not to do the way of the catheterization or the suprapubic. I chose to get a urostomy bag, which is located right over here. And it's been the best thing that I ever did. I've had it for 15 years. It's a pouch, they have to empty it probably every 4 hours or so, but it works out great for me. Now I can go out and empty it in a bottle anywhere. And at night we just hook it up to a night bag and it works out great. They'll empty it before I go to sleep at night, and then they'll empty it in the morning. So one other thing I can talk to you about is, as you can see, I'm wearing my mask. And this time of the pandemic has been a real struggle for anyone disabled that's really stuck in the house. You have to be so careful because our immune system is compromised. So you have to be very careful. So which means you stay in the house a lot. Sometimes you have aches and pains and worries. I call them PWL days, pain, worry, and lonely, because you don't get to see very many people. You can talk to them on the phone, but there's nothing like socializing with your friends. So it's so good to be able to talk to you and share my story, and hopefully something positive will come out of this. Thank you.
Hi, my name is Matthew Kloss. I was injured when I was 26 from an arterial venous malformation inside of my spinal cord, which resulted in a T10 complete paraplegic. So I have sensation about here on my belly button. Something I really struggled with in the beginning of my injury was urinary tract infections, UTIs, which are very common with people who have spinal cord injuries. Due to the nature of a spinal cord injury, you're using a catheter constantly to urinate. You're introducing a lot of bacteria into your system. Something I found really helpful was to coordinate my healthcare with a urologist who specializes in people who have spinal cord injuries. Once I was able to get someone who understood the nature of my injury, we also hooked up with an infectious disease doctor so that when I did have these infections, I had a support system right on board who could really mitigate me having to go to the hospital, which in the beginning, quite frequently, I was going in and out of the hospital for these infections. Another real big component I think that's important to talk about is mental health. going through a traumatic injury, whether it be a natural occurrence like mine, having a stroke inside my spinal cord, or a acute trauma injury such as a motorcycle accident, it really takes a toll on your mental health. Prior to my injury, I really struggled with that, and I found therapy like cognitive behavioral therapy, also pharmaceuticals to be really important. But especially after my injury, that really became evident that I really needed some help. A spinal cord injury really puts a lot of toll not only on yourself but also your family, and it really exacerbates the situation that I was dealing with. Making sure that you're getting the help that you need, be it a therapist or a psychiatrist, I think is really important for anyone dealing with a traumatic injury like this. Like I was saying earlier with the challenges of dealing with a traumatic injury, something that I found really helpful was dealing with these issues and talking about them out loud with a peer mentor. Specifically, I was able to meet a lot of really invaluable resources. Through the GBC Boston, I was able to find myself a peer mentor, which has really been invaluable, and I would highly suggest to any newly injured patient. I've been able to stay in contact now through the majority of my entire injury, and it's really been helpful to speak to someone who's been there, done it, and has done it for an extended period of time, much longer than I have. Be it with helping with your mental health or cathing techniques, going to the bathroom, finding a new routine, getting back into the job market. It's really an invaluable resource that I think everyone should look into.